Hi, my name is Brandy Thompson. I'm a student at St. Joseph's College of Maine. This is my final project for NP 602, and here we go. My patient presents with ongoing depression. She is currently treated with an antidepressant. She reports having seen a commercial for Abilify or aripiprazole. She is wondering if the drug may help her. She definitely feels better on her antidepressant, but can't help but want to feel better if possible. The commercial is done in cartoon, which all of Abilify commercials seem to be. It begins with a woman and an umbrella. The person in the commercial describes her depression as being partially managed. She states, "I was handling it, but sometimes it still dragged me down," at which point her umbrella pulls her down into a hole in the ground. The cartoon person describes talking to her doctor, who suggested adding Abilify to her antidepressant as an adjunct to therapy. The audio part of the commercial claims that some patients may report improvement in 1 to 2 weeks. Below the cartoon scene is written disclaimer that results are based upon a 6-week study and that results may vary. Then the patient stands confidently and states that she feels more in control of her depression. She wishes she had spoken to her doctor sooner. The next scene depicts the doctor offering a warning. Abilify is not for everyone. Call your doctor if you have unusual behavior, worsening depression, or thoughts of suicide. The commercial warns that antidepressants can cause increased symptoms of suicidality in children, teens, and young adults. It states that Abilify is not for dementia due to increased risk of death or stroke and is not approved for children under 18. Warnings include muscle stiffness, involuntary movement that could become permanent, elevations in blood sugar, and that in extreme cases could lead to coma, increased cholesterol, weight gain, dangerous decreases in white blood cell counts, orthostatic dizziness, seizures, trouble swallowing, and impaired judgment and motor skills. Written below the scene where the cartoon patient is happily picking apples in an orchard, the commercial warns to use caution before driving or when operating heavy machinery. The commercial ends by stating that results may vary. Be sure to talk to your doctor about adding Abilify and to ask about the free trial offer. Throughout the commercial there are multiple places where the website and consumer telephone number is listed. The commercial leads the patient through a thought process. This drug is conventional and accepted. If you take it, your antidepressant will work even better. You could really decrease your depression, perhaps in little as 1 week. There are a lot of risks to taking this medication, but feeling better is worth the risk. Go ahead and ask your doctor. You could try it for free. Warnings in the product insert not included in the commercial include body temperature dysregulation, neuroleptic malignant syndrome, and tardive dyskinesia. In addition, the insert describes a clear risk for extrapyramidal symptoms with Abilify use as compared with a placebo. Boxed warnings include contraindication for psychosis and dementia due to increased risk of death and the increased risk for suicidal thoughts or behavior in children, adolescent, and young adults. In addition, Abilify is not approved for treatment of depression in children. Drug interactions include ketoconazole, quinidine, fluoxetine, or paroxetine, all of which increase Abilify's action and require a dose reduction if used concurrently. When both carbamazepine and Abilify are used, the Abilify action is significantly reduced. The package insert denies any need for dosage reduction in patients with renal or hepatic impairment. Contraindications include using with alcohol or breastfeeding. The most common side effects were seen in at least 10% of the subjects in controlled studies. For adults, symptoms included nausea, vomiting, constipation, headache, dizziness, akathisia, anxiety, insomnia, and restlessness. For children ages 6 to 17, symptoms included sleepiness, headache, vomiting, extrapyramidal symptoms, fatigue, increased appetite, insomnia, nausea, stuffy nose, and weight gain. Other indications for Abilify include bipolar 1, both mixed and manic, schizophrenia, and irritability and autism for children ages 6 through 17. Pharmacodynamics are not completely understood, but it is believed that Abilify is a partial agonist at the dopamine 2 and the serotonin 5-HT1A receptors and acts as an antagonist at the serotonin 5-HT2A receptor. Abilify has category C with teratogenic effects in animal studies. I believe the pharmaceutical commercials are a double-edged sword. In one way, they bring topics that are sometimes stigmatized into the light and say, hey, let's talk about this. You're not the only one with this problem, and this drug may help you. This allows patients to seek help and feel enhanced ownership in their health care, and these are good things. But on the other side of that sword is misdirection and sometimes misinformation. Commercials are better in recent times about disclosing possible risks, but they are intended to sell a product, and there is bound to be some spin on their drug. Imagery, music, and cartoon details are all designed to lead the consumer down the path towards their particular product. Commercials attempt to simplify a process that is not simple. Diagnoses are made based on a set of symptoms, and drugs are prescribed based upon diagnoses and the set of symptoms. Commercials portray patients as the set of symptoms and the medications as the fix for the diagnosis without accounting for individual factors. Admittedly, consumers should be able to discriminate between advertising magic and reality, but most of the time the consumer relies on the provider to give them all the information and make an informed decision on their behalf. If my patient was interested in this medication, I would first clarify if the patient is telling me that they are having partial relief of depressive symptoms and continue to struggle with clinical depression. I would thank the patient for being proactive and looking for solutions to their health concerns. I would explore other symptoms the patient may be having and examine what the expectation of the treatment is. I would offer non-pharmacologic interventions in addition to exploring drug therapy. Wu and Win cite that one of the most common mistakes providers make in pharmacologic treatment is believing that a partial improvement is satisfactory, so I would be open to exploring other medication options with my patient. I may remind her that Abilify is not for everyone, as it says in the commercial. Abilify may be cost prohibitive, as it is approximately $800 per month supply. I have some concerns about this drug's safety profile. Young patients are at risk of extrapyramidal symptoms, and older patients report gastrointestinal symptoms and restlessness as the main side effects. Positive outcomes would include opening the channels of communication between provider and patient and having dialogue about risk versus benefit of medications. I thank you for your time.